Hello friends, welcome to my YouTube channel Neuron Pain Clinic. My name is Dr. Rajendra Sahoo. I'm a consultant pain physician at KIMS Hospital and Neuron Pain Clinic, Bhubaneswar. Today in this video, I'm going to show you one of the most difficult scanning parts, that is the gluteal and pelvis ultrasound. So in this video, I'm going to show you how to scan in a stepwise systematic manner to identify the gluteal muscles, the piriformis, the pudendal nerve, and then of course going down below the quadratus femoris muscle for the ischiofemoral impingement syndrome. Okay, so please watch this video till end so that you can have an idea to understand this anatomy of one of the most difficult part. So here I'll first explain that with a skeletal model here. So my step 1 scanning technique is going to be putting my probe over the posterior superior iliac spine, PSIS. So this iliac crest, when I put it over here, I take a low frequency curvilinear probe. I first scan in a transverse plane, slowly move down in this plane till I reach this area of the pelvis, that is called the greater sciatic notch. So once I reach this area, what I do, so this area is occupied by the piriformis muscle. The piriformis muscle is little obliquely oriented, not in this transverse, little obliquely oriented. Keep this in mind. So from S2-3 anteriorly occupies whole of that greater sciatic foramen and goes into the greater trochanter. So once I reach this area, the greater sciatic notch, which one can appreciate as a break in that bone hyperechoic line, then I do certain things. This is very important. So I move my probe slightly lateral, little oblique in order to orient in the direction of the piriformis muscle, and then I do certain heel toe maneuver, look in, so that whole of my ultrasound beam goes into the pelvis. So from here, look here, from here in this plane, once I reach here, go lateral, slightly oblique, look in. So these are the three things that I need to do so that I can see the piriformis muscle very well. In this plane, I go further inferior till I reach the ischial spine. So this is the ischial spine. So once I reach that ischial spine, that hyperechoic line which was like this at this level will slowly become straightened like straight line, and there will be continuity in the hyperechoic line, that is from this ischial spine to the sacrum, that is called sacrospinous ligament. I have to identify that. On top of that will be your sacrotibialis ligament, and in that plane between these two ligaments you will find the pudendal nerve or a pudendal nerve block. And in this second little oblique scanning, and then as I scan little down, I will see this ischial tuberosity, the obstructive internus, and I can scan down further for that quadratus femoris muscle. So I am using a low frequency curvilinear probe. Step 1, I'm putting over the PSIS, posterior superior iliac spine. So this is that PSIS. Okay, so this side is lateral, this is medial. One can see that bone. So that is the sloping part of the ilium. Here on the top of the bone, this is gluteus maximus, medius, and further down is going to be minimus. Between medius and minimus, sometimes you see that blood vessel superior gluteal artery there. Slowly scanning down in a transverse plane like this, down, down, slowly. Keep looking on that continuity of the bone. Once I reach that greater sciatic notch, you won't see that bone. See here, that is a continuous bone. I'm just about to enter into the greater sciatic notch. Here, once I am there, you see that bone is not there. So this is part of the bone over there, and this is that greater sciatic notch. Going up, you see the bone. Slowly going down, you don't see the bone. So from now, what I do, once I reach that greater sciatic notch, I'll come little lateral, obliquely orient and look inside. So this is the three things that I do. So once I am there in oblique manner, so I bend the knee and do a internal and external rotation to show you the piriformis muscle. That is the piriformis muscle. The top muscle is gluteus maximus there. Okay, so here, so if I do this movement, that is the piriformis muscle. Below the piriformis muscle, that is the sciatic nerve there. Below piriformis, that is the sciatic nerve. Okay, so for people, those who are suffering from piriformis syndrome, so if you have to do a piriformis injection, your needle has to come from medial side or at least 2 centimeters away from it. Okay, like this. like this, you go into the bulk of the piriformis here. So that is the sciatic nerve. Don't go too deep. So bulk. You do it here. You can probably go a little there also. So you can do a diagnostic local anesthetic, corticosteroid. You can do dextrose. You can do a Botox. So that is the piriformis. Okay. From this scanning technique, I'll slowly. So this is a kind of curve-like appearance of that part of the bone, which is posterior part of that acetabulum there. Slowly keep scanning. I'll go towards the pudendal nerve. Scanning, scanning, scanning down in this plane slowly till that hyperechoic line or that bone becomes straightened. That means you are reaching the ischial spine. Slowly going down, down, down. Now one can see this is a straight line. Okay, and if you look the medial side, that straight line continues. So that is the attachment of sacrospinous ligament. Okay, that is a sacrospinous ligament. Have a look at this. If I just go down a little bit, scanning down, you don't see that continuity anymore. Going up, you see that continuity. If I go further up, you don't see it anymore. So for that specific time, that specific location, there is the attachment of that sacrospinous ligament to this medial end of the ischial spine. So here at this level, you see that straightened line, straightened ischial spine, and the continuity of the line, that is the sacrospinous ligament. If you look on the top, that white line is sacrotuberous ligament. This is the gluteus maximus. So you see a pulsation there. That is the pulsation of internal pudendal artery there, internal pudendal artery, and just medial to it here, pudendal nerve should be over there. For injection, needle comes from medial to lateral. You pierce the sacrotuberous ligament. In that interligament, you stop it over here. So that is the location, end point for your needle tip position for a pudendal nerve block. If I continue in this plane further down, this is at the ischial tuberosity line, and that is your that is your obturator internus muscle. So here at this level, what you see now, this is the ischial tuberosity, and that is the muscle of. So one can see the ischial tuberosity and the greater trochanter there. That is the sciatic nerve, and just below that is going to be your quadratus femoris muscle. That muscle is quadratus femoris, the deep muscle there. Below that, sciatic nerve. So for a quadratus femoris injection, one has to go from lateral to medial, inject into that muscle. Okay, that's quadratus femoris. So that concludes a stepwise examination for your gluteal muscles, starting from here, starting from PSIS, seeing these muscles, reaching the greater sciatic nerve, looking for piriformis, slowly going down, ischial spine, sacrospinous ligament there, sacrotuberous ligament, that's for the pudendal nerve, just medial to the artery, that is where you do the pudendal nerve block between tuberous and sacrospinous ligament, and then go down, that is for obturator internus. Here at the top, this obturator internus, if you want to do a Botox there or something for obturator internus, go down further, that is for your quadratus femoris for ischiofemoral impingement. Thank you for watching. If you like it, don't hesitate to subscribe and share among your friends.